Dental implant costs. Can you afford it? Stay tuned. It is difficult to answer the question directly because treatment plans are just as individual as our patients. Typically, implant work will have two costs. A surgical one, which includes the placement of the implant into the bone, and a prosthetic one, which includes the crown, bridge, denture, or anything that goes on top of that implant. Rather than shopping for a dentist by cost and calling and asking how much is an implant, first come up with a proper treatment plan for the teeth you need to replace, and then allow the dentist, if they don't do the surgery themselves, to send you to a surgeon with whom they want to work and from whom they can expect a proper result. It is unfortunate that as a surgically trained prosthodontist, I've seen too many cases where implants were not placed in the proper position, or too many implants were placed and complicate the restorative work just because the implants were cheaper. So let's just buy more, right? In short, before asking to the individual cost of an implant, speak to your dentist about a proper treatment plan, about who should place the implant, whether it's them or a surgeon that they will send you to, and only then tackle the cost. That would make it much cost efficient, and at that point you will actually pay once for the work. Just remember, shopping by the cost of the implant could be a problem because you might be able to afford the cost of the implant itself, but you might not be able to afford the cost of the restoration that goes on top. I'm Dr. Zev Kaufman. Make sure you hit the subscribe and the notification bell for some more solid dental advice.